Hello everybody and good morning. Clearly coming to you from a different spot, not in my usual little birth beat office. I'm in Sydney for a few International Women's Day events, which has been wonderful and slightly exhausting, to be honest. And I missed you all for our 10 a.m. live on Monday. So it is lovely to be here. I did not realize, I have to say, when I got dressed this morning that I actually match. I match the wall of the motel where I'm staying in, which is hilarious. Now, so many questions came through on Monday, and we just had the most wonderful day celebrating International Women's Day. And then I went on to a 2-day conference, which was called Future Women's Conference, which was fabulous. And I'm feeling all pumped up and inspired for the business and spreading this to more and more women. So I am super excited to be jumping on here and answering any of your questions that you might have around pregnancy, birth, baby and child first aid, or sleep and settle. And I know I didn't give anybody a warning. I didn't jump on the tribe and say that I'm jumping on and going live, but I am here and I'm here to answer some of your questions. As always, Jessica, good on you. I love knowing who I'm talking to. Please say hello. Let me know either how many weeks pregnant you are or how old your bub is, and fire any of those questions that you would like me to answer my way, and I will get onto it. If you are new and you've just stumbled across Birth Beat, hello and welcome. We provide a community where you can ask questions, about your pregnancy, birth, or newborn baby, and I am a registered midwife and I will do my very best to answer your questions. So firstly, hi Jessica, good morning. 19 weeks from Brisbane. I missed you on Monday. Yes, I missed you all too. It was so funny. I was like, oh, I miss everyone. When should I start to feel bub move? Haven't felt any movements yet. Is that normal? Awesome question. Now, Jessica, I will say, particularly for your first time pregnancy, I find that women start to feel that the movements or the sensation of movements a little bit later compared to when it's your second or third pregnancy. It also depends on the position of your placenta, can impact when you start to feel those first little movements. But I would say any time in the next few weeks is likely that you're going to start to feel some movements from your bubba. Originally, not originally, but like initially, what it first feels like is like a bit of a, I describe it like a butterfly fluttering around inside of your stomach. So really just lie down and feel and take some time and concentrate on that sensation. What did everyone else feel like if you've had that feeling already? I describe it like a butterfly, but I'm sure that everyone's had different experiences, but it's sort of like a bit of a fluttering. It's not like in the movies where you feel a big kick or a punch straight away in those early days. Remembering at 19 weeks, your baby is still about the size of my fist, so they can't really do those big punches and kicks yet. But it will not be long, Jessica, until you start to feel those. I'm imagining that you are seeing your midwife and having your antenatal appointments, and you'll be hearing the fetal heart. So that's always lovely and reassuring. So I would say in the next few weeks, I think my first sort of true movement that I felt wasn't until about 22, 23 weeks. So it's totally different for everybody, Jessica, but I am curious to know what everybody else thinks. So say hello, let me know where you're watching from. I'm going to get into some of the questions that have already been sent through, and I will also jump on Instagram and answer a whole bunch of these in stories today. I am sorry. As I said, I've been in a 2-day conference, so it's been really hard to answer all of your questions. Hello, Danielle. Jess said, yeah, there you go. So Jess said that she didn't feel her baby move until 22 weeks, Jess. So there you go. Similar timing to me. Hey, Danielle from Sydney, 39 plus 5. Yay. Not long now for you. Second bub. Can't wait to birth. First birth was epic. Can't wait to birth again last week on only 4/5 engaged, been bouncing all week. So when we talk about babies becoming engaged inside of your pelvis, what that means is how far, and I don't have Junior in my pelvis here with me in Sydney, so I find like I'm feeling very lost not being able to show you all that. But when we talk about 4/5 engaged, what Danielle is referring to is how far Bub's head is down into the pelvis. So that is super exciting, and not long until you'll be meeting your new little Bubba. I actually was standing in the line at this conference yesterday and chatting to this lady, and she's like, oh, what do you do? And I said, oh, I'm a midwife and I teach online childbirth education, first aid, and sleep and settle. And she was like, oh, I so wished that I had have had that. So she lived in Melbourne, but she worked full time for the police. And she was like, I so wished I had have had that. And I said, if I had $1 for every parent that had have told me that, I'd be a gazillionaire. Natalie says, after 4 years of trying to conceive, my wife, yay, is 5 weeks pregnant after going through IVF. Very early stages, but we are excited and look forward to getting started with Birth Beat soon. Yay, congratulations, mamas. That is so exciting. And that's it. It's a long journey for some people, and so it gives me tingles to hear that. So I'm so happy and so excited for you both. That is awesome to hear. Hello, Sunita from Auckland. I have almost 8-week-old this Saturday. How much should the awake time for an 8-week-old baby be? Sunita, that's a great question. And I have to say, a lot of women who go through our sleep program, so our sleep program shows you how to help your baby get more sleep, but also ultimately for you and the rest of your family to get more sleep, because sleep is super important, not only for your baby, but also for your physical and mental health. So that is why I'm super passionate about teaching people what's the expected awake sort of feed, play, sleep is what we work off. So for an 8-week-old baby, Sunita, I wouldn't imagine that your little Bubba is awake for more than 45 minutes, probably an hour max for their awake time. They do a lot of sleeping at this time. So if you want some guides, like if you want to know exactly feed, play, sleep, how long to expect Bub to be awake for, sleeping for, and when to feed, just come and have a look at birthbeat.com at our sleep programs, because within our sleep program, we actually have all the age appropriate guides as well. When I say 45 minutes to an hour as well, that includes, whoops, I've currently got my phone propped up on a book and a cup of tea in the window of the motel. So I just saw it do a little, so if it falls over, you know what's going on there. So around the 8-week, that also includes feeding your baby, changing nappies, and that's the maximum. If your baby is showing tide signs, so remember, tide signs can be really subtle. It can be a little bit of redness around the eyes. It can be a little bit of twitching in their hands and feet getting more active, and you know what they look like when they get a bit twitchy. Crying is a late tide sign. So what you want to do is try to get to know the tide signs of your baby. It is much easier to put a baby that's not overtired to sleep and get them to stay asleep for longer. So please, if you're seeing signs of tiredness earlier than 45 minutes, by all means, put the baby down to sleep using our sleep routines, and that will make the world of difference for you, Sunita. So come and check that out at birthbeat.com. Patricia has said, how do I get my 6.5 month old to learn to put herself to sleep? We're in a bit of a habit of napping on me and falling asleep on me of a night, which makes it hard sometimes. Oh, Patricia, that does make it super hard, I know. And I'm really conscious, and I'm always wanting to reinforce that when I talk about different sleep settling guides and different sleep settling techniques, that it's not for everyone. And if you're loving, so I have some people who say, no, let your babies fall asleep on you all the time. It's beautiful. If that works for you, then that is great. But it doesn't necessarily work for every parent. I personally, particularly when I had my second baby, I found it really difficult to settle Theo. And I couldn't constantly carry and hold and have him fall asleep on me, because I also had a 2-year-old that I needed to be looking after. So I get it, Patricia. And that's why I say, sleep, and when you're needing help with sleep or talking to me about sleep, it's only a problem if it's a problem for you. So at 6.5 months, it is a really great time to give your baby the gift of learning to go to sleep so that you're not having to put her to sleep for every sleep or having her sleep on you. If you were coming to me and saying, but I love having her sleep on me, it's not a problem at all, then I'd go, great, that's excellent, keep doing that. But the fact that you're asking me, and I'm saying this to everybody, is that it does sound like it's a problem for you, and I want to be able to help you. For 6.5 months, so we have different sleep programs. We've got 0 to 12 weeks, and then we've got 3 to 6 months, so that 12 weeks to 6 months. You would probably come and look at the 6 to 12 month course, Patricia, and really at 6 months, that bub has a very strong sleep association with going to sleep on you. So what we need to be doing is replacing that with some positive sleep associations and some sleep associations that your baby can do themselves. So I would probably recommend to you, so you're in a bit of a habit, is what we call spaced soothing. And I can teach you how to do that in our program. It does take a bit of time. It does take a bit of work. It does take commitment from you. But I promise that if you stick to the settling techniques that I teach you in the program using spaced soothing, you will be able to give your baby the gift of going to sleep themselves. And that is absolutely a gift, so that they're not relying on you or relying on a family member to put them to sleep as they get older and older, because that can then become very challenging. So come and have a look at the program, and it's the spaced soothing technique I would recommend for you for a 6.5 month old. Because at 6.5 months old, they're very aware of their surroundings. So it means a bit of going in, making sure that you comfort your baby, let them know that you're there, but not putting them to sleep, but rather letting them go to sleep in a nice, calm way. Ashley has said 26 weeks today and currently sitting in pathology doing my glucose test. I can't believe how many of you actually tune in while you're doing your GTT test. I hated that, Ashley. So I hope that it is all going well. I think I vomited like 3 or 4 times in my GTT test. Linda, hello, my son is 5 months old. What a beautiful age. I call that the danger zone, Linda. Around 5-6 months old, they're gooing and garring and they're just adorable. And it's when you go, let's have another one. And then you're a very, very busy mama. Danielle from Mackay, 36 plus 1 today, and bub is huge, possibly getting an induction date today. Danielle, if it makes you feel any better, remember Theo was 4.2 kilos on the 97th percentile, and I had a beautiful vaginal birth with him. So just know that all babies are on the spectrum. I mean, like they all have to be either 0% or 100%. But let me know how you go. Stephanie, I was engaged for 4 to 5. I feel like there's probably more to that message. Have I missed it somewhere, Stephanie? Talia, 10 weeks pregnant, been so sick. Any tips on lessening morning sickness? Oh, yes, Talia, it is awful. So a few really, really helpful tips are often it is when you're eating larger meals and then you have periods where your stomach is empty that the sickness can and the nausea can be so much worse. So even setting an alarm in the middle of the night and having a few dry crackers so that you don't wake up first thing with an empty stomach and have that awful, icky, nauseated feeling. Then first thing when you wake up in the morning, having something beside your bed that you can eat and drink, and just drinking small amounts, eating small amounts. I say little and often. Bland food often is tolerated better, so some salty crackers, having that first thing in the morning before you get up and start the day definitely helps. I'm sitting on a bed and I'm realizing that I'm bouncing around a lot, sorry. And also a lot of rest, Talia. This isn't something that you just have to push through. It is super tough. So trying to get some rest in, I don't know what your job or work commitments involve, but that can be really tough, particularly in the early stages of pregnancy. But trying to get lots of rest during the day, eating little and often, and having something salty and dry first thing when you wake up in the morning will help. Rowie from Aberdeen, first time mum, settling in with my 2-week-old bub. Bub doesn't want to settle during the day, takes ages to get him down after a feed, but during the night he sleeps for a good 2-hour stint after each feed. Rowie, I would strongly recommend you come and have a look at our 0 to 12 week course. Oh, that's the other thing. So today is the last day of our introductory price. So you can actually get that program for $77. You get to watch all the videos, all the advice about what to do for a 0 to 12 week. That is going to be going up as of midnight tonight, because that is our special introduction course cost. So Rowie, I've got a lot of settling techniques in there. Particularly, it's good for you to know that during the 0 to 12 weeks, you're not creating any habits. There's no negative sleep associations. It's just what works for you and Bub. But different settling techniques, including how to swaddle your baby really securely, how to create the optimal sleep environment, how to do shush pat and side settle, will definitely help for your little 2-week-old Bubba. But at 2 weeks, remember, this is still what I refer to as the 4th trimester. So your Bub is still wanting so much closeness from you. So fill Bub's cup as much as you can during the day. Really have a look at that course and have a look at what is your sleep environment like. Is it nice and dark? Do you have the white noise? You know, do you have the settling techniques to help Bubba to go to sleep? Because this is all new for you, but it's also all very new for Bub. So we need to be able to show you and help you and guide you onto what that looks like so that you're not feeling like you're just, you know, surviving. I want you to be thriving. Stephanie said 4 to 5 weeks, it was a long wait. Sue, can I go straight to table food or do I have to first do baby food? Sue, that's a really great question and definitely something that we're asked a lot in the Birth Beat group. So when you become part of our Birth Beat community, you actually come into a closed Facebook group where lots of our mums talk about these things. It is totally up to you. There are no hard and fast rules. However, it is absolutely okay to give table food. Please just be conscious of the size of the table food and always supervising your baby. So what I do say is if you are doing baby-led weaning or introducing family foods, just be conscious of the size of the food. Please, if you haven't already, go and check out what to do if your baby chokes. We actually added that as a bonus into the sleep course for the 6 to 12 month package because I think, and I'm so passionate about all parents knowing what to do if your baby chokes. So there's no right or wrong. You can choose what you want to do, but just please make sure that A, Bubby's ready to start solids, B, that you supervise Bub, and just be conscious of the size of the foods. You don't want to be like cutting a sausage into a little circle because that's the perfect size. Or if you're giving grapes, making sure that you cut them in half. Just being really conscious of the size of the food is what's more important. Oops, somehow I just lost all the comments there. Michaela said, help, my baby is 14 weeks old and sleeping in bassinet, but outgrowing so quickly. Started day sleeps in cot for transition. Not rolling on floor, but noticed kicks legs sideways, was on her side, nearly over. Worried me and back to bassinet, sleeping in sleep ergo suit. Do we arms out now? I'm overly cautious of SIDS. Michaela, firstly, you can't be overly cautious of SIDS. Good on you. I'm so glad that you're educated and informed. If it is showing like Bubby's going to be rolling onto their side and that you've gone in and noticed that they're on the side, so it's not necessarily that they're rolling, pushing themselves like that. Kicking their legs up and flipping them over and pushing themselves onto the side is a sign of early rolling. So yes, it is time for you to transition that beautiful Bubba into arms out. However, there's no reason to be going back to the bassinet. It is perfectly safe for Bub to be in the cot. Just make sure that you are, again, the cot is set up with SIDS guidelines, so you're not going to have a bunch of toys or pillows or bumpers or things like that. Bub is just in their sleep suit. When you're putting them to sleep, it's on their back. But once they can roll onto their side, that's absolutely fine because they can roll onto their side. So there's nothing you can do to make your baby stay on their back once they've learnt to roll. But it is just a recommendation is to be doing arms out. So you are spot on and doing everything perfectly, Michaela. Jade, 39 weeks, let the countdown begin. Yay, how exciting, how exciting. Sunita said, thank you, my pleasure. Lucinda, hi Lucinda. I'm 35 weeks and having a C-section in 14 days due to the size of Bub. He has been a small Bub, but oh yes, but his abdomen decreased in size to 2%. Lucinda, I said, and we were trying to catch up for a call, weren't we? Let's still do that because I'd like to go through a few plans for you. Okay, so starting to increase again, now back to 12%, so he was decreasing. Look, Lucinda, I don't feel like I'm the best person to answer that question. Definitely your obstetrician is. But let's have that call together. Okay, Chica? Sorry, can you send me an email and remind me? It has been a crazy few days. I really would like to have a talk with you and talk through a bit of a plan there. So Lucinda's done our Birth Beat Childbirth program. So when there are things that are a little bit more complicated, I will jump on the phone and have a call with our clients, because sometimes things are really specific and you wanna go a bit deeper on that. So we can absolutely do that. Margaret, how do I get my 3-month-old to sleep for more than half an hour at a time during a day? Yes. Oh my gosh, Margaret, that's the worst when they're just catnapping. Margaret, come on to birthbeat.com today because you get our guide for $77, not $97. And seriously, what is $77 if I'm going to be giving you more sleep? And get our 3 to 6 month old program, and I'll be able to hold your hand through doing exactly that and addressing catnaps because it is the worst. Patricia said, thank you so much. My absolute pleasure. Hello. Oh, yay. Rowie signed up for the 0 to 12 sleep program last night. Welcome, Rowie. I hope you've got your logins and you've been able to start looking at the videos and all of the downloadables. That's so cool. Brianna, hi Edwina, just starting solids and wondering how often Bub needs food. Does she just need 1 or 2 teaspoons once a day? And when do we increase solid feeds each day? Brilliant question, Brianna. And again, we go through this actually in our sleep program. I know it's a sleep program, but nutrition and how to feed your baby is so closely related to sleep. So we've just started solids. So what I recommend is 1 meal a day. And yes, you're doing that perfectly. A couple of teaspoons that increases to a couple of tablespoons over time. And then you can start to introduce another meal. So starting off with 1 meal a day, whether that's breakfast or lunch, and then introducing the next meal, doing that for a little while, then you introduce the third. So it's just a nice gradual process. Don't stress too much about it. If Bub looks hungry and is wanting to eat a little bit more, you can give a little bit more. Sometimes Bub might go through a bit of a, not very hungry, and that's okay. Please don't stress about it. Alicia, hi, just wondering, should I feed my 8-month-old solids before breast milk? Lots of confused info. Look, Alicia, and this is actually why in our sleep program we do the nutrition and we say when to feed, sleep, play, how to fit that all in, because I agree, it's completely overwhelming. There's too much information that's so conflicting on the internet. So for an 8-month-old, normally they would wake up in the morning about 6:37, have a milk feed, and then you can have a bit of time, have about 45 minutes, an hour even, until they have a solids feed. Then you would be expecting them to be having a solids, then a milk feed at lunchtime, then a bit of dinner, maybe afternoon, they might have a milk feed as well. So usually about 5 milk feeds in a 24-hour period and 3 meals, and you can offer 2 snacks. So I hope that is helpful, but we've got the whole guide in the program if that is easier for you. Brianna said, thank you, my pleasure. Okay, thanks. Zoe, just booked the 0 to 12 sleep program. Yay, 31 weeks and due in May. How exciting, Zoe. Guys, that has been awesome. I will jump on and answer more of your questions on Instagram today, and then I will be back for our Monday live. But please know that all the sleep programs, the introduction price ends at midnight tonight. So I will jump onto Birth Beat Tribe and let you all know that as well and send you a little reminder, but I don't want you to miss out. And I am going to talk to you all soon. Anna, I recognize that room. Good on you for keeping up your lives when you're away. Anna was here at the conference with me as well. Look, Anna, my t-shirt even matches the wall. How funny is that? I didn't realize that when I got dressed this morning, but I thought that was hilarious once I went live. Guys, love it. I will be back live on Monday morning to answer all of your questions. Jump into the Birth Beat Tribe, and I will be answering more in stories on Instagram throughout the day. Okay, talk to you all soon. Bye.